I'm going to just do a quick thumbnail sketch of how the climate crisis affects our health in Wisconsin and why acting on climate can be a huge opportunity for health. The first obvious one, of course, is that we are seeing hot temperatures. We have an initiative here, the Wisconsin Initiative on Climate Change Impacts. Some of the best climate scientists in our state that are looking at this. We have observed hotter days, and these heat waves are accompanied by extremely hazardous weather like tornadoes and floods. We'll talk about that in just a second. But aside from the direct impacts of heat, and we know that heat kills people and it puts people in the hospital, there are also a number of infectious diseases, especially carried by mosquitoes, that are quite sensitive to small shifts in temperature. And we're already seeing some mosquito-borne viruses that are moving northward into our state. Now, of course, remember the climate crisis, it's not just temperature, it's also extremes of the water cycle because hot air holds more moisture. So when it rains, it can really rain hard. We have seen in the upper Midwest, you see the dark green with the black hash marks, meaning statistical significance. We have absolutely seen statistically significant higher levels of rainfall, significantly higher compared to the the 1950s to 2000. And those impacts include water contamination and illness, drownings, of course, and breeding sites for vector-borne diseases, harmful algal blooms. There are lots of problems with this intense rainfall. But oftentimes after a flood event, and you're expecting a spike in diarrheal disease and water contamination, what the ERs are seeing are people coming in with asthma after they're cleaning up from flooded basements. And unfortunately, our racist past and flooded future, it's a big problem when you think about the redlined areas. See 25% more of this flood risk, which leads us to a broader issue of health equity and climate justice. There are certainly different population groups that are at risk from climate change. You can see those highlighted. In addition to the what I talked about as far as the flood risk, there's a study of over 100 US cities showing that the heat wave risks are also greater in red line areas. It's just there's a climate equity story here. And people spend a lot of money just for energy. If you're poor and you're spending 10 or 15% of your income on energy bills, that's also a problem. What about the opportunities? Well, a study was done by some UW team, UW-Madison team, that asked the question, could Wisconsin generate all of its electricity from in-state sources? We spend over $14 billion out of state to import electricity generated from coal and dirty sources. But this scenario on the left shows that you can have clean energy sources and have all of our energy from Wisconsin from in-state, from clean sources. And yet, what does this benefit? Look at the incredible benefit that happens. Almost 2,000 lives would be saved every year from reduction in air pollution, and all those other health effects decreased. And every year, the reduction in fine particle pollution and ozone would lead to fewer deaths and fewer hospitalizations, such that we would save $21 billion every year in reduced mortality and hospitalizations because of cleaner air from cleaner energy sources. And oh, by the way, create 162,000 net new jobs. So unbelievable opportunity. Now, we released in October of this past year, October, we released this medical alert, how climate change is harming our health in Wisconsin. This report and a lot of the work that's been happening right now is from, we are grateful to a grant from BRICO Fund, which is a local nonprofit that has been helping us. So this is something you can visit this website and download this report that summarizes some of these impacts. And finally, I just want to mention something about COVID, because we are still struggling with the COVID-19 pandemic. On the front end of COVID, we know that habitat destruction from deforestation and also climate change forcing bat migration, unseasonable problems as far as bats migrating and finding food sources. The upfront climate and ecological damages were very much responsible for the zoonotic disease spillover and the emergence of COVID. Mix in some wet markets, international travel, and you've got the COVID pandemic. On the back end, research out of Harvard showed that places that are polluted have a higher risk. You have a higher risk of dying from COVID. Just 1 microgram per cubic meter of air of fine particles, PM2.5, gives you an 8% increased risk of dying from COVID. So environment at the front and back end. And this picture from New Delhi, India, what could be clearer? The before after shutting down the fossil fuel economy because of COVID. So golden opportunity. Action on climate means getting off of fossil fuel, because fossil fuel air pollution causes 1 in 5 deaths worldwide. So now, as we emerge from this pandemic, this is the perfect time to build back better, to go to clean energy. A low carbon future will be unbelievably healthful and something we can do. And in the healthcare sector, this is what we're talking about, getting to a clean energy system and reducing air pollution. It's a golden opportunity.